So we go from one maternal death to another without an improvement in the system. So it's not good enough for us to hear after each death that there's going to be some improvement in investigation. We want to know what are the specific things that would be done to prevent the next death.
What is interesting is that Dr. Anthony should have had by his side Dr. Barry Ramsaran, okay? And he should have been directing all his questions to Dr. Ramsaran. Because while both of them might have been a doctor, he had nothing to do with the health sector for the longest while. His expertise would have been to explain to the Guyanese public why is it that they paid so much money for that swimming pool that they built that could have built 3 or 4 times more with that kind of money.
Health Minister Dr. George Norton, responding to the PPP's spokesperson on health, Dr. Frank Anthony, who recently placed the country's health sector under his microscope. Dr. Norton says executives of the PPP should be ashamed to go public about the health sector.
We want to hear about the money that was spent on Carifesta, why persons were left unpaid. That is what Frank Anthony should come and tell this government, not to talk about a health system that they left here, that they had 22 years to put in order. It's not 22 months, 22 years they had. And he's questioning about the health system now. Dr. Anthony should be ashamed of himself.
His remarks were made during an exclusive interview with Nightly News on Monday. Dr. Norton is questioning Dr. Anthony's competence regarding health issues. He said Dr. Anthony has failed the straightforward department like culture, youth, and sport, and added that the PPP should direct all health-related questions to former Health Minister Dr. Barry Ramsaran.
Everything has been in problems under him. If it wasn't cricket, it was football, it was boxing, That is what he should be asking about, not health. Let them bring out their health minister to ask about health. But they can't bring out their health minister because he knows that he is responsible for the situation we're in.
The public health minister said he is committed to improving the public health care system and questioned the wisdom of those who expect him to fix it in just 6 months.
I am worried about the maternal death that we are having. I'm worried about the infantile mortality rate. It's high. It's high. There's no doubt about it. I'm worried about the number of suicides that are taking place. But I'm going to give it my best effort. I'm going to give it my best shot to better it. It is not going to be in 6 months.
Dr. Norton said too that although there will be bottlenecks, the political will is there to make it right. Royden James, HGP Nightly News.